Welcome, everyone. I think it's 6:01, so it's time to get started here. My name is Kimberly Stepien, and I'm a professor in medical retina here at UW-Madison. I'm also the director of the Inherited Retinal Disease Clinic, and I also serve as vice chair of clinical affairs for the Department of Ophthalmology. It gives me great pleasure to welcome you to our first Saving Sight session of 2022. The Saving Sight sessions are a series of community educational programs that we created to share our discoveries and developments to stop blinding diseases, enhance treatment, and improve vision-related quality of life. These sessions were started in 2014 as part of the mini med school series hosted by the Wisconsin Foundation and the Alumni Association, and the UW Health School of Medicine and Public Health to help provide an insider's view to medical education and research. So here at the Department of Ophthalmology, these sessions give us a chance to share the way we are transforming eye care and give the community a chance to learn about all the groundbreaking vision research we do here at UW. And wow, are you guys in for a treat tonight? We have an exceptional speaker, Dr. Amitha Domalpally, who will be telling us about a cutting edge technology, artificial intelligence, and its application in ophthalmology. Her work and that of the AI unit that she directs has the potential of completely revolutionizing everything from the way we conduct ophthalmic clinical trials, which evolve our ocular therapies, to the way we approach screening for potentially blinding eye diseases, such as diabetic retinopathy. We are so lucky to have her as a speaker tonight. Dr. Domalpally completed her medical degree and did her ophthalmology residency at Christian Medical College in Vellore, India, and received her PhD in clinical investigations from the University of Wisconsin in Madison. In 2007, Dr. Domalpally joined the Wisconsin Reading Center here in our Department of Ophthalmology, where she serves as its research director. To date, Dr. Domalpally has authored 58 papers, probably more, knowing Amitha, and almost 100 abstracts around important topics such as ocular imaging, treatments of wet macular degeneration, dry macular degeneration, uveitis, diabetic eye disease, and retinal vascular occlusions. She's also serves as a principal investigator or co-principal investigator on multiple National Institutes of Health grants. More on this later. She's also won multiple awards, including the prestigious ARVO Pfizer Ophthalmics Translational Research Award and the American Academy of Ophthalmology Secretariat Award. Importantly, she has also mentored many trainees through the years, helping shape the future generation of doctors, researchers, and visual scientists. In 2021, Dr. Domalpally started the AI unit, I spelled EYE, in our department with the goal of evolving the use of artificial intelligence in ophthalmic imaging. Her work is supported by a $20 million grant, Bridge to AI, through the National Institutes of Health, which she serves as its co-principal investigator. So we'll be hearing about this work tonight, and I can hardly wait. Just a few housekeeping things. We will have a question and answer session immediately following the presentation. So please note your questions and send them to us in the chat so that we can discuss them once the talk is done. So without further ado, it gives me great pleasure to introduce a brilliant person and a wonderful friend, Dr. Amitha Domalpally. Amitha.
Thank you so much, Kim, for that kind introduction, and welcome everybody to this talk. This is a great forum. I am truly, truly honored to be here. And I'm gonna start sharing my slides, and let's see if that works. All right, there we go. And on full screen. Am I good on full screen?
Yes, you are.
Thank you so much. Again, like I said, it is truly an honor to be here and present to you about all the research we are doing in artificial intelligence with respect to eye care and ocular research. And I just wanted to say we have an upcoming conference, the Association of Research and Vision in Ophthalmology. And out there, when we have presentations, we get ribbons to represent you. If I have a talk or if I have a poster, if I'm on a panel, I get a ribbon. One of those ribbons is if you can translate your research for a non-scientific audience, you get a ribbon. That is how important this kind of presentation is. And I hope at the end of this talk, I get a lot of ribbons, because this is a 45-minute talk trying to explain artificial intelligence and the research we do. So again, welcome, and we will get started. And this is the first presentation of this year. We will have one more and Saving Sight session. And the last 2 years, if one thing we have all been addicted to, it is watching a lot of TV, because really there wasn't much else to do. So we're going to start with our Netflix show and get on with it. Okay, so the show today is called Eye on AI, and the goals of the talk are to go through the terminology and the technology of artificial intelligence and how we employ this in research and in eye care. All of us are used to artificial intelligence in our life, whether actively or whether we know it or not. So when you watch Netflix and all those recommendations come for you, that's artificial intelligence playing its game out there. And if anything, the last 2 years, we've been feeding it a lot of data by watching so many shows. And the AI keeps getting better and better. Artificial intelligence, what is it? It's the art of making computers that behave like the ones in movies. Well, that's a simple way of putting it. But we'll get into more on what actually artificial intelligence is about. There's a lot of words thrown around: AI, machine learning, deep learning, the blockchain, chatbots, all kinds of things thrown into this mesh of AI technology. What it actually means is artificial intelligence is this big umbrella term that identifies a technology which can mimic human intelligence. Machine learning is a type of AI where you improve the technology, the AI, by programming. Deep learning is a type of machine learning where the algorithm can train itself, and that's what deep learning is. So how does AI work? Well, you've got to train the AI. The AI has to learn how things look. So if you're trying to teach an AI to identify how cars look, you would show it some pictures of cars and some pictures of non-cars, and these are called labeled data, and that's the training data. And once you have an AI that is trained, then you show more pictures and you say, okay, tell me which of this is a car and not car. And this time it's not labeled. So the AI has to identify on its own. And so the AI says, I know that's a car and that's not a car. And that's called testing the AI to make it work. So what is the difference between machine learning and deep learning? In machine learning, we actually put in the features that we know into the system. So if you're trying to train an AI to identify a car, we say, hey, a car has 4 wheels, it has a hood, it's shaped like this, whereas a bus is more boxy, it's like a rectangular. And then the AI, the machine learning model learns, okay, that's a car and that's not a car based on all these things that I'm supposed to look for. With deep learning, there is no such feature extraction or giving such information into the system. With deep learning, we just show pictures of car and the AI learns, this is a car, this is not a car. There is no explanation of why this is a car. And because we don't know what the AI or the deep learning model is using to learn this is a car, we call that a black box. We have no clue what the AI is using to learn these features. So moving on to the eye, this is a picture of the retina, the back of the eye, which we can take photographs of. And training a machine to diagnose diabetic retinopathy is much like training a medical student to learn. So you can teach on retinas. You have to train the person on structures of the retina, how the retina looks in a normal eye, what are the lesions that can happen in an eye in retinopathy. So these are all the hemorrhages and the blood that leaks in the disease. There are artifacts that happen in the eye, so don't mistake them for the lesions of retinopathy. This, for example, is a camera dust that can occur, which can interfere with the picture. So what do we do about that? Things like that. And classification, so how severe this disease is and how to identify where it is. And this is how a medical student or a resident would be trained in ophthalmology in identifying diabetic retinopathy. For machine learning, it's very similar. We would train the same. So we would label the image and put all the labels out there. This is blood, this is a hard exudate, this is a camera dust spot, don't call it anything. And so we would go on labeling. And like I said, with deep learning, that doesn't happen. So this is a machine learning system where we have the retinal image, we have all these features outlined. So there's that feature detection, and that's how it would identify. Now with AI, we just show the picture and the black box or the CNN or the convolutional neural network, the deep learning model identifies, knows this is diabetic retinopathy and marks it. And that's how AI models work. So in 2015, somewhere around there was a competition called the Kegel competition. And this Kegel group has predictive modeling analytics for many things in AI. Some of you may have heard about this. This is the group that defines Zillow home value predictions, dog breed identification, giving YouTube video tags, giving music recommendations on Spotify, or those Netflix kind of recommendations, criminal detection, cervical cancer screening, and diabetic retinopathy made it to their list. So what they did is they took a bunch of pictures and put it out there and said, anybody wants to try developing an AI model to detect diabetic retinopathy, go for it. And so they had 7,000 entries. So many people competed. And it was like a gaming competition. People just kept building AIs that would detect these. Most of these people were not even ophthalmologists or had any ophthalmic background. They didn't even know what diabetic retinopathy meant. In fact, I think if I remember right, I read in a blog that either the third or the fourth person on the list, on the leaderboard, was a high school kid. So they built these AI models to detect diabetic retinopathy. So what did we learn from this competition? We learned that retinal images are a great area to explore these deep learning techniques. And this competition gave us a peek into the black box. So this is an example of an image that was given in the Kegel competition of the retina. And what people did is they turned it into black and white, and the AI still worked. It could identify diabetic retinopathy. They rotated the image around, presented it in all kinds of rotational formats, and the AI could still detect diabetic retinopathy. They made the picture grainy, like a low resolution, and the AI still worked. So we kind of understood that the AI was at least doing things differently than humans. We know that it was smart, it could identify things, and it was good, but it was different, and we needed to understand the black box. The very next year in 2016, Google got interested in this, and Google's AI side for called DeepMind started exploring these retinal images. And DeepMind within a year took a huge data set of images and developed an artificial intelligence program to identify diabetic retinopathy and compare it to ophthalmologists. So this was their paper in 2016, where they said it's development and validation of a deep learning algorithm for detection of diabetic retinopathy in retinal fundus photographs. And they took huge, like I said, big number, 9,000 plus 1,000, almost 10,000 images. And there were 7 US board certified ophthalmologists who also labeled these images, and the AI went head to head with these ophthalmologists and performed equally. So what did the doctors say? Well, this is great, but ophthalmologists can look at all the information comprehensively. When we look at retinal images, we're not looking at just diabetic retinopathy, we're looking at everything that could happen in the eye. And this model can work only on color photographs. And there's many other kinds of imaging that we do in the clinic, so this wouldn't apply. And the output is what we call binary output. So it says diabetic retinopathy, yes or no, and that's all it'll say. It doesn't say how bad it is or whether it needs an immediate doctor referral kind of a thing. And it's not a diverse data set. What this means is that if the algorithm or the AI model is developed on a certain population, it'll work only on that population. So if it's developed in China, it cannot be used in the US, things like that. So difficult to generalize it. And of course, we do not like that black box. What is it even looking at? So the next year, a bigger group of, this time it was not just Google, but a lot of academicians from across the world, scientists from across the world came together and said, development and validation of a deep learning system for diabetic retinopathy and related eye diseases using retinal images from a multi-ethnic population. So they sorted out the multiple diseases, so it was no longer diabetic retinopathy alone. And also this was a multi-ethnic group. And again, big number of data to train on, 70,000, 15,000, and it performed very well compared to professional graders. So this worked really well, and it was an impressive publication. So what did the doctor say this time? Pretty good, but maybe it can help us get better by assisting. So it's a great tool for screening and identifying things, but we do need a bigger validation by independent groups. We need clinical trials to make sure that this is doing what it says it's doing. So we are in 2017 now, and the next year in 2018, a group from Iowa called IDX came up with an AI algorithm, which in a clinical trial, which was the very first FDA approval for artificial intelligence use in the human body. Anything, it's not just the eye, so the entire human health sciences. This was the very first one done for ophthalmology. And this was FDA approved for screening certain diabetic related eye problems. And what this model did is there's a camera, you go put your head in the slot, take a picture, and out comes this report, and it says, you have more than mild diabetic retinopathy, you need to see an eye care professional. And this is approved now and fully functioning and deployed in many clinics. The fun part was that there is the Wisconsin Reading Center, which is a clinical trial imaging lab within the Department of Ophthalmology here at UW-Madison. Some of our retired graders are probably on the call. If you are, hello. Hi, Barb. And I don't know if Jane is there, but hi. And the Reading Center graders were the reference standard to compare the artificial intelligence algorithm. And what does a reference standard mean? It means that the AI model had to be as good as the graders at the Reading Center. If it performed as well, it was good to be approved by the FDA for use in patient care. So Diabetic retinopathy screening is one of the first uses of these AI models, and it's very, very effective there because less than 50% of patients with diabetes meet current screening recommendations for eye disease. So the model works really well. The screening requirements for diabetic retinopathy are very simple. You just need an image and a diagnosis. So why AI? That's because the process is very complex. You go take a picture, we don't know if it's good quality or not. It has to go to a human. That human has to look at it, say, hey, this doesn't look like good quality. You have to dilate the patient, come back, take another picture, then send it, and then it gets a preliminary diagnosis, and then you get referred. So it's a pretty complex process. The AI simplifies this. So you get the camera, which can take this picture, and this AI model is incorporated into the camera. So it's a one-stop shop. The goal is from all these companies is that maybe they can put all these in malls, and one day we can just take a picture and it tells you what your prediction is. That's how easy they're trying to make it. So today, there are many AI-enabled diabetic retinopathy screening systems. IDXDR was the first, we talked about that, and the second one got approved last year, or 2 years ago, called iArt. And there are many more in line to get approved. Some of these, RetMarker, the Singapore Seri, they are very good systems, but they're not used in the US. Google has a system also that they are working on. And so this list keeps growing every day. So we talked about diabetic retinopathy so far, and moving on to other things. So we talked about diabetic retinopathy classification. And what are some other things that AI can do? Some of you may know what this is. This is optical coherence tomography, OCT scan, that is taken. And patients with wet AMD who get injections into the eye on a regular basis get this imaging, which tells the physician, the ophthalmologist, hey, there's fluid in the eye, the patient needs more injections or not. So the AI can actually detect the fluid and quantify it and can tell you whether the fluid is getting better or not. And that's another great use of AI. Another use of AI is prediction. Geographic atrophy, or GA, is another feature of macular degeneration. And AI can predict how much this GA is going to grow and how far and what's going to happen, what's its future trajectory. So those kind of things are helpful in planning treatments and prognosis for patients. So now, since I promised you that we'll watch Netflix and we'll watch a movie, I'll turn this on and we'll watch this story together, this little cartoon that I made. So the year is 2025. The pandemic is all done. We are traveling, we are partying, we are socializing like in the past. And this is Mrs. Jones. And Mrs. Jones wants to go visit her kids in New York, her son, grandkids. Easter is coming up and she wants to make this trip and have a family get together. But there's a problem. She's not been able to see well out of her left eye for the last about a week, 10 days maybe. She's wondering what to do. So she takes an appointment with an ophthalmologist who takes a look at her, examines her, gets his questions and checks her out and gets some images to take a look into the retina. And we talked about those OCT scans. So he gets an OCT scan and says, well, you've got wet AMD. What you need is an injection into the eye. And in 2025, there is this gene therapy that requires just one injection into the eye. So with this one injection in the eye, you will hopefully have everything sorted out. He also gives her a machine, which he says you need to take home. This has artificial intelligence in it. And what will happen is that this machine will monitor you. It'll take your OCT scans and check your vision. and do all the things from the comfort of your home. So she schedules her check on that machine back at home, puts it on her calendar, does it as required. And these reports that are generated from this machine go to her doctor. And her doctor takes a look at all these reports that come through the AI without her having to leave the clinic, leave her home, and tells her, all is well, you can make that trip. Now, Mrs. Jones is ecstatic. She is so happy now that she can see her grandkids, and it's time to go shopping. All right, so that is the end of our movie, and hopefully this will come true. I made this movie probably 2 years ago, and things are going in the right trajectory. So I'm really fingers crossed that this will come true, and this is not just a imagination. So moving on from the eye, what else can AI do? AI can actually give us insights into systemic diseases through retinal imaging. So using retinal images, the AI can predict many things like age, gender, body mass index, smoking status. And this is where the black box feature of AI comes. We really don't know how AI is able to do this. And Google actually has many news media releases about how their AI algorithm can look at an image and tell you whether you're what your age is and whether you're a male or a female. AI has also got great uses to predict neurodegenerative diseases, and this may be one of the most useful tasks of AI for systemic biomarkers. It's able to predict, by looking at the retinal images, risk of dementia or risk of Alzheimer's. There's a lot of work going on in this area, so we don't have fully functional models yet, but it's looking very promising. Another area where it's very interesting to use retinal images is cardiovascular risk. Now, because the eye is the only part of the body where we can see the blood vessels without any invasive technology, just a photograph, a picture can show us the vessels, and all the vessels in the body will generally behave the same way. So the retinal vessels give an indicator of general cardiovascular stress status, and we're able to predict blood pressure, stroke, heart attack, and even detailed markers like HbA1c and creatinine levels. So there's a lot of research going on in this area and publications coming out about, every day there is a new thing that the retina can show. And so the eye, from being just a proverb, the eye is a window into the soul, it is truly a window into the body now, and we're able to see so much more. So how does AI work? We talked about the car and the bus and all that, but here's one thing. When we train, we generally show the AI, like just that car and the bus images. Here it's apple and oranges. And so we've got the training data set, we've trained the AI, and now it's time to perform, test it. And we show it a basket and say, show me the apples, show me the oranges. And it works really well. But then what happens when you start showing it a basket of green apples? It's never seen green apples before. And the AI doesn't know that apples can be green. What happens when you start adding other fruits? It doesn't even know those are fruits, and things like that exist. So this is when the AI model starts crashing and doesn't function. So to train these AI models, we need thousands of images, a variety of cameras, diverse population, widely distributed pathology, lots of diseases, lots of things happening in the eye, and humans have to accurately label these images. So while using these AIs is a fantastic thing, training these AIs is not easy. And if you do not do the training in the right way, the AI does not work well in the real world. It only works in that training environment and doesn't perform in the real world. And that's been the biggest obstacle of bringing AI into patient care, that it cannot function when it is supposed to. So what is the black box looking at? What is it looking for? So like I said, that's an area that we've been struggling a lot with. What is it looking at? So now there are techniques called explainable AI that can highlight, and these are heat maps that can tell us which are the areas that the AI is picking up the pathology from. And by looking at these and knowing that, hey, as a human, I would pick up from the same areas, it feels a little more trustworthy. So we have to build a lot more of these trustworthy tools to believe the AI and know that it is doing the right thing. And then there is this interesting thing called the adversarial examples. And these are examples that are all over the internet, where people take pictures of just not dogs, but anything. And there, the AI identifies it as a dog. And this is an AI trained to identify images. And you make certain modifications to the raw data, to the inside. And the image looks the same to a human, but the AI starts calling it something different. Like in this case, a dog after those changes is called red wine or toilet tissue. We don't know why the AI does this or what is happening. So somebody applied this to the retinal images, and the same thing happened. Post modifications, the AI that was functioning well and identifying all these diabetic retinopathy images just did not know anything and could not function once those modifications were made. So there is still a lot to learn on the AI front. What is it able to do and how does it actually work? And looking under the hood is something that's going on. And we know that the black box doesn't think like humans. There are, of course, pitfalls of AI. And one of the things we talked about is that all AI models are biased towards the training set. So if you train the AI on something, it just knows only that. So it learns specific features about the training data. There was an example of a colleague who trained an AI model to identify a disease from retinal images, and the AI model functioned really well. And when it was deployed on another data, it just failed absolutely, like nothing, zero, as if it was an untrained model. And then when they went back and looked at the explainable AI to identify, well, what is this AI? How did it work so well on the training? It actually looked at the number code on the top right of the image, which just identified patients with a certain number if they had a disease and did not, and the AI learned that. So the AI tries really hard to please you, to be good, to do the right thing and give you the right answer. Doesn't matter what they do. It doesn't matter if it needs to cheat to get you the answer, it'll get you that answer. So the AI doesn't learn, as my colleague Robert Slater in the AI unit says, it doesn't learn, it copies, and that includes mistakes also. So if we make mistakes in our labeled data, the AI learns that. And so that's a very important thing, that the AI, we hear a lot in the news about how the AI is biased. Well, the AI is not biased. The AI just learns human biases and just adapts to them. So all our mistakes are automatically transferred to the AI. And training is expensive. These models need a lot of power, a lot of big machines. They often use specialized hardware. And unfortunately, only a few companies can afford this kind of hardware and have the kind of data. So along with this research being expensive and difficult, it's also now becoming more and more restricted If a company like Google's gets into this kind of research, they have the best of the machines and the best of the images, access to a lot of things. That's something that, you know, researchers cannot compete with. And so that becomes an issue in this area. And so I'm sure you all came to this presentation with that one question: will AI replace doctors? And I hope at the end of it, you have the answer, even though we really haven't gotten to this topic. Listening to all this, I think you know what the answer to this is. Well, it is not a matter of man versus machine, but it is man with machine. So how can we use AI to help us do our work? And I think the term artificial intelligence will probably need to be replaced with augmented intelligence. And that's kind of the way a lot of scientists are going, because it's not just AI working in isolation. It is always a hybrid environment where the AI works with humans and we help the AI get better, and the AI helps us do our work better, higher skill tasks. So that's where the term augmented intelligence comes. So in healthcare in general, AI is being used for, has already been put in use for many things, such as decision support systems, triaging patients, identifying who need emergency reviews, who doesn't. AI has been very useful to develop new medicines, particularly because it can run through various permutations and combinations and scenarios. So AI has been very, very helpful in that area. Cancer screening is one area where AI has been working really well. That's a rapidly progressing field, along with those diabetic retinopathy screening platforms. There's many cancer screening FDA-approved AI models that are now out there. But then they all go through this, you know, yes, no, and then review by a radiologist for further decision making. And treating rare diseases, AI has been very, very helpful in these areas, because the number of patients are small for human to identify patterns, but AI can put all that data together and look at patterns and help us get ahead in our research. Another area where AI has been helpful is to identify which clinical trial will match which patient and help patients choose the best clinical trials for them. So the future of AI, so what I talked about till now was where all AI has already been employed. And the future is in this precision medicine, where the treatments are tailored to the individual based on various data points and inputs you have. So in that example I gave you, there's a gene therapy. So there will hopefully be therapies available that are exactly what are required. Right now, it's one shoe fits all kind of treatment. Everybody gets that same anti-VEGF. Everybody gets that same injection, same drug. But with precision medicine, it'll be easier to know, using artificial intelligence, it'll be easier to know which patient needs what kind of treatment based not just on their disease, but their environment, age, demographics, genetics, all that. So it's a wholesome look at the patient versus the way we do medicine now. And this whole concept of digital twin is coming up with AI, where knowing all your past history from the medical records, a twin can be created, a virtual twin of a patient who will be built based on all that information of the patient, and treatments can be tried on that digital twin and not really on the patient. So you say, okay, if you have this and I give you this medicine, what is your trajectory going to be versus this medicine? So the digital twin concept is being increasingly embraced, and a lot of companies are working towards this to see how can we build digital twin into our healthcare systems, so that before a patient gets a treatment, it's already been kind of practiced on another virtual environment. So very fun future ahead of us. And, all these are not just science fiction anymore. There is a company called Digital, I think it's a Twin Health or something, that already does digital twins. So it's all coming towards us. And so we have an exciting future waiting for us. And I wanted to end this talk by saying thank you to all my colleagues at the AI unit. Jared, I know you're out there, Robert, Ramasa, and Kevin. They are amazing to work with, and we have a lot of fun putting together these AI models. And every morning I wake up and I have these 6 ideas before breakfast sort of thing, where can we develop an AI model for this? And then we go talk to the team, and it's a lot of fun. The Wisconsin Reading Center, Dr. Barbara Blody leads that, and you all, some of you may know her. The Wisconsin Reading Center has been an amazing source and support for the AI unit. And the ophthalmology department, I have to give a big shout out to Chris Molina, Kristen Larson, and Ellie Fraser, who behind the scenes have helped put together all this, and Dr. Kim Stepien for that wonderful introduction. And most importantly, thank you all for being here and giving the time to listen to this research. Like I said, this is truly an honor for me to be talking to you. And with that, I am happy to take any questions. Thank you so much for your time. And I can stop share. I believe you can put the questions in the chat box to make it easier, and things will be forwarded.
Amitha, thank you for such an excellent talk. That was really wonderful. I really enjoyed that. So I just want to remind everyone, if you have some questions, please type them into the chat and we can ask Amitha those questions. But well, can I get started? I have a question for you, Amitha. Here at, in our Department of Ophthalmology, we do a lot of clinical research trials. And we, as part of those trials, we take a lot of photographs of the eyes and of the retina to kind of understand if our therapies that we're testing are working. So how is AI being used right now to look at some of those research images that we're taking, or how do you see it evolving as we go forward?
Yeah, that's a great question, Kim, and right up the alley of some of the research that we are doing right now. One of our biggest issues with clinical trials is finding the right patient for the trial. And what we can do is have AI help us identify the patients who are right for the trial. And for diabetic retinopathy, some of these trials only need a certain kind of retinopathy, not everybody with any retinopathy. And so we are actually building an AI model that will be presented at ARVO, which can use an image and detect if the patient fits that criteria or not. And we can fine tune that based on the clinical trials requirements. So those are some areas where it's absolutely useful. Another area is identifying people who will potentially progress rapidly. For example, macular degeneration, we know, is a slow disease, but treatments cannot go on for 5 years for clinical trials, and people want to finish it in 2 years. So if there is a way to identify people who will progress faster and prioritize treatments for them, then that helps finish the treatments and also get the treatment to people who need it. So that's been another area where we are working on to identify rapid progressors.
Cool stuff. Great. We have a question in the chat from Tim. It said, most excellent and affirming. When might we see this technology in or on our phones?
Tim, great question. I believe the new last 2 years or 3 years, the upgrade in iOS now allows AI models to run on phones. So that AI models do require certain power, and the phone applications are now upgraded enough that they can run an AI model. So the next thing, at least for ophthalmology, becomes how do you take a picture on the phone? Thankfully, there are companies that have that too, where you can attach a small lens to the phone and it can take a picture of the eye. So there are companies working on this, and hopefully we'll see that soon, where you can have an iPhone and you can take a picture of the eye, and it'll tell you what to do next and where to go. So there are, of course, a lot of implications. What if it is wrong, or what if it detects something else? And how do we monitor it? What is the quality control? So developing iPhone application that can take a picture and tell you what's happening isn't the tough part. It's the next part of getting through the logistics of how to make it happen. But there are companies here. I believe one of them is even in Madison. So
That's great. We have another good question in the chat. It's from Zachary. He said, thank you for your presentation. We looked and talked a lot about retinography. So I think he's thinking photos of the retina. Are there other imaging modalities that you see AI being applied to in ophthalmology?
Yeah, great question.
Mm-hmm.
So yes, there are many applications for AI models. We are actually working on these images called autofluorescence images of the retina, which are black and white pictures, and they look at cellular content in the cells of the retina and take a picture. And we're working on those for patients with macular degeneration to see how fast anybody will move along in the disease. So their OCTs are being used quite a bit on Genentech has a great AI model. Genentech, the company that makes Lucentis, they have a lot of AI models also that they're working on to identify diseases and predict. So yes, if there's an image, we can make an AI model for it.
Great. Eva had a nice comment. She was wondering about when will one-shot be available for AMD? And I think she was referencing your great video of Mrs. Jones and her very effective treatment. So what kind of hurdles do you see to getting to that type of reality?
Yeah, so the clinical trials are underway, and as any clinical trials, they have to go through multiple phases. We have to make sure these treatments are safe and effective on patients, and they don't cause any damage. So they're currently ongoing. They are getting into the phase 3, which is the ultimate step before FDA approves. So hopefully another 3 to 4 years, we'll know. These trials cannot be done in 1 year, 2 years, and we stop. We need to know long-term effects before they are out into the community. So in another 3 to 4 years, we will know. Probably not 2025, but maybe 2026, 27, we'll be there.
I hope so. That would be wonderful. I know I have a lot of patients who would love that. So, and a lot of doctors too. So you showed us some beautiful examples of how AI has been used to screen for things like diabetic retinopathy and for glaucoma. We've also heard in the news about a lot of health disparities. And how do you think AI is going to change the way we do screening, especially in places where they may not have great eye care like we do here in Madison, Wisconsin?
Right, that's another great question, Kim. And health disparities is one of the most important topics, I think, that is being discussed in the world of AI. Honestly, any grant application that we do as researchers for developing AI models has to address health disparities. Otherwise, it will not even be looked at by the National Institute of Health. So the advantage of AI, like that image I showed you, is that the AI can be deployed into the camera. And now there are handheld cameras that are being made, which have these AI models built into them. So it's almost like one of those old toys like the Viewmaster, which you put in front of your eyes and take a picture and it'll tell you what you have and whether you need to see anybody. And of course, the goal is to expand this beyond diabetic retinopathy. Diabetic retinopathy is the biggest problem and easiest to handle, but expanded before. So though availability of those kind of equipment in primary healthcare centers will bring this to the patient versus bringing the patient to the clinic. So that's where that would be helpful, having these in community centers, all those, making it easy for people to know what they have and what they need to do.
As we look forward to spring and summer, maybe we could be in campgrounds or in water parks and fun places like that too, huh?
Mm-hmm.
Get all our screening done while we're having our
yeah. Have one at the Union.
Yeah. Let's see. There's another great question here. Has the AI detected anything a doctor might not be able to detect from an image?
Yeah, cool question from the cool introverts group. Yes, the short answer is yes, many things that are very surprising. And I did mention one of them, which is age and gender. That's a tough one for a doctor to look at a picture and say, we can't look at a picture and predict the age. Well, there's some changes that you can look at for age maybe, but if there is no disease in the retina, no pathology, it's hard to say the age. The gender is almost impossible, but the AI is able to do that. And things like smoking, that's also not possible to look at a retinal image and say, but the AI can look and say that you've been smoking or you're non-smoker. Apart from cool stuff like that, there are many other things that the AI is able to look at an image and predict that a human, that an ophthalmologist is not able to. For example, in glaucoma, the AI is able to look at a picture and say how your visual fields will look about a year from now. Kind of generate a model of the visual fields that it thinks that it will be. And when they compared it to, the researchers compared it to an actual visual field from a year later, it was true. The AI's prediction was true. So those are really exciting areas.
So it sounds like AI could actually be helpful in the clinic for our physicians to kind of understand maybe the best treatment options for that patient as they present, things that the doctor may not know offhand.
Yes, that is true. Can help to present treatment options. But again, I would like to take a step back and say, while the excitement is there and while AI can really do miracles, the AI depends on the training data. If our training data has any inaccuracies or any mislabels or biases built in, the AI model will not perform. And that's kind of where bringing it into the clinic without any supervision is scary. So with supervision, yes. So that trust building for the ophthalmologist looking at the AI and saying, okay, you're right versus no, you're not right. I'm going to make the decision here, kind of a thing. That's the approach that we need to take.
Oh, good. So us doctors are still worthy, huh? So
oh, yes, good. Very much.
Great. So, AI has been, it sounds like it's been applied to screening and into some clinical care. Do you think this could affect the way we do surgeries in the eye?
Yeah, robotic surgery is such a big field. It's managing the fine movements, especially for the eye, ocular surgery, because we're operating in such a small space and every movement can affect the eye. So yes, artificial intelligence is extremely useful. One of the areas where AI is already kind of being used is laser input, kind of looking at the eye and predicting how much laser, what time, and things like that. So laser surgeries, that's another area where AI is very, very helpful.
Great. And we
Yeah.
have another question. What about images in other areas like colonoscopies or x-rays? Do we see AI playing a role in those areas too?
Yeah, so after IDX got approved, a whole bunch of radiology related images were approved. Just this morning, I was talking to a company who has 3 models that work on X-ray for various things. Now, one of the issues with AI in the current technology is that it can only work on one thing. So if there's a model for diabetic retinopathy, that's all it works on. It's not so good on another. So there are ways to stitch AI models together and make multiple ones on them. But again, it's an upcoming technology. And I mean, from the talk, this only started in 2015, which was not so long ago. So, and has made so much progress since. Yes, radiology is far, far ahead in the world of AI and has made a lot of progress.
That's great. And we have another comment from Tim, mitigating health disparities across the globe. That's a fabulous goal for UW and USA's medical professionals. This research is in excellent hands with Amitha and Kimberly and all of you. Thank you. Oh, thanks, Tim.
Thank you.
Yes, and we're just so lucky to have Amitha kind of leading this charge in our department because it's a brand new novel area and it's just so exciting. So lucky that we have her and have her great team working on all this stuff. So is there anything that a person could do to help you push AI forward? Is there a way that we could like donate images or something, or what's the best way to kind of support the initiatives that you're working on here?
So images definitely are useful, and that is kind of the bread and butter for training AI models, and obtaining well-labeled high quality images is not an easy thing. Mm-hmm. So we do struggle in that area. And one of the advantages of being in the Department of Ophthalmology is the support of the Reading Center, where we can collaborate with the Reading Center to get those images. But one of the things that we can do in the clinic is having some sort of a registry for patients to say, I am willing to participate in this AI research and you can use my images. Mm-hmm. I think that would go a long way because that is real world, and that is where these AIs will be deployed. So having real world images is the way to go for testing any of these models. So we are working hard to get the registries located and available so that anybody can sign up and give their images into these registries, and that will hopefully be ready soon.
That's wonderful. And you're right. Like you mentioned, you need high quality images. So, and our UW photographers are fabulous at a lot of our technicians too. So yeah, we'll look for that. That'd be fun to have in our clinics. We have a question from Chris here. It said, when are we helping to train AI systems when we have to fill out those frustrating online security measures where we have to identify pictures of things like stop signs or stoplights and road signs before we can proceed to buy our concert tickets or yep.
Totally, exactly. That's what you're doing. You are feeding the AI with every time you do those security measures, every time you talk to Siri, every time you talk to Alexa, you're just making the AI better and better. So yes, there was actually a presentation by one of the people or a collaborator from the person who actually created that stop line and road sign process. So that was cool to listen to. So yes, we are. AI is everywhere, all around us.
It's amazing. It's evolved so quickly. So I remember when we didn't even have cell phones. So I'm repeating myself here. Look where we are now. One more question from the cool introverts. Where could I find out more information about this? And I think he is talking about our the clinical
registry. Yes,
Yeah.
so we are working to make this go through the UW Ethics, our institutional review board, to make this happen. Once it is ready, there will be information out in the clinics on how to join the registry.
Yeah, and I'm sure, being a clinician, once we have this up, we'll be telling our patients about this and getting everyone excited and interested in this. So probably talk to your docs too, which would be great. So great. Well, we are already at 7:01, so our time is up, but what a wonderful night and what a great way to hear some really exciting research. So thanks again. And thank you everyone for joining us. Remember our Saving Sight sessions happen twice a year. So look forward to another session later this fall. And just thanks for everyone for coming, and have a good evening and enjoy that spring weather that will soon be on its way, I promise. Thanks, everybody.
Thank you. Thanks all. Bye-bye.
Good night. Bye-bye.